I wanted to be a doctor in high school. I've always really liked science, and I knew I wanted a career where I could mix science with helping people. Family medicine is a very broad medical specialty. We get to see people all the way from newborn babies up till the end of life. We deal with people who are healthy at their physicals or their well visits, chronic diseases like diabetes or high blood pressure. We also see patients for acute or sick visits and do some procedures as well. I like to work with patients to help them meet their health goals. I don't like to, force a patient to do a treatment plan that they're not comfortable with. I really like to tell them what my assessment is of the situation and give them several options to find the option that's going to fit best into their lifestyle. Women really do need to have preventative health care exams just to make sure that we're not missing anything and that we're taking care of them. It's so important for women to stay healthy. They can come in for their yearly physical. We'll make sure they're up to date on all of their preventative healthcare screenings like mammograms. Women have unique needs throughout their lives in relation to pregnancy and birth control. That's something I enjoy helping with as well. I have always loved reading books. When I was in medical school, I set a goal to read 52 books in a year, which was a little bit crazy for medical school, and I actually managed to do that for about 3 years. I still try to make sure I always have 1 or 2 books that I'm reading. I also like to cook. On the weekends, I like to do more elaborate cooking that I don't have time for during the week. Curries and stir fries and casseroles, those are some of my specialties. My husband and I like to go for walks and go for hikes. We're always looking for new trails to explore. We also go for bike rides on all the trails around Des Moines. My patients inspire me to be better. I find it especially rewarding when I have a patient come in who says, that they haven't been to see a doctor in a while, maybe 5 years or even 10 years. You get to work with them and show them that going to the doctor doesn't have to be a scary or a bad experience. I will listen to them carefully. I will make sure I take into account all of their concerns. I will help work with them to achieve their healthcare goals.